one of the frustrations I hear a lot from parents is when they do try to change behavior in the way of getting kids to eat a cleaner diet or getting the supplements into the kids consistently, they struggle with the negotiation with the kid to get them to comply. Do you have any insight on what parents can do to help negotiate that with their kids over the period of the program?
Yeah, and that's going to depend on the parenting skills because it's hard for me to say because I've been a doctor all my life, 20 years or so I've been a doctor and I know and I've been a hospitalist. So when people come into the hospital, they need medicine that I never thought, okay, are you going to take it or are you not going to take it? Because a lot of time these are life-threatening illnesses and you have to take it because of what are the options. So I look at autism when I had my son and I looked at him. I look at it just that way. There's no negotiation. This has to be done. So that's my perspective. That's how I did it. I mean, you just have to take the medicine. And I think that if some parents can look at it, some parents just can't because they don't want to push their kids. They want to negotiate. But if I look at it, if your child had a really bad pneumonia, or your child had type 1 diabetes, they don't get this. They have to get shots with the type 1 diabetes. They don't get this. They're going to end up in the ICU. They're not going to survive. So the shots are painful, but you're gonna make sure it happens because there's no option. So for me, when I was going through it, I said, in my mind, that's how I look at it. There is no option. So this has to be done. So I know they have feeding therapy for people that are really challenged with kids taking food, taking supplements, and they can work with you slowly, play around with it. A lot of patients tell me they learn how to touch it to the face, touch it to the cheek, and then kind of get adjusted to it. Maybe put a little piece in your mouth, and they slowly can. So for every person and every parent, personality is different. They could work, slowly along that way, that line. So it depends on other things you could with my son, I really tried hard. So if he really did like something, I find a way. I change it around. I find a way to I'm gonna tell you this one that I did. I did this I can't.
Mhm.
So I always made these big pots of broth, my meat stock and my bone broth, and I would give him, the goal was for him to have a cup with each meal. So he really did not like that bone broth. So what I did was because of what will taste good to me probably will not taste good to him. So I tried everything. So eventually for breakfast, I would have his cup and I would add the bone broth and then I'd add some of those chocolate syrup in there, a little chocolate syrup. And then he liked it. So it wasn't the same taste all the time. So then I realized, okay, so he does it tastes bad to me, but I just kind of each meal, so it won't be the same thing and you get tired of it. I'll try to add little things to it so that way, and just test him with it. And if he doesn't like that, I find something else. And I find that it's really, you just have to keep working it until you find something. But giving up is not an option. It's just finding what works with that child.
So the advice would be you really need to have a lot of patience, be willing to stick with it, and then each day you just have to really focus on being creative and changing
Right.
things up until you find that right formula to get it going in the right direction.
Exactly.
Okay.